torn tissue, sharp, sudden waves of pain that stop you in your tracks. Cramps so deep they don't just hit your body, they rattle your sense of calm, your focus, your patience, and sometimes even your identity. Some discomfort passes, but some pain stays, lingers, pulses, and makes you rethink what you thought you knew about your own body. And the truth is, many women move through the world carrying these experiences quietly. They go to work, take care of families, show up for life while managing levels of pain that most people never truly understand. So today, we're talking about 5 of the most intense and challenging medical experiences the female body can go through. Some of them are surprisingly common, some are rare but unforgettable, and some are so overwhelming that even describing them doesn't do justice to what they actually feel like. This isn't about fear, and it's not about dramatizing. It's about awareness, understanding, and respect for the body, for the women who live in it. Let's get into it. Sex 0.5, Bartholin cyst. The name sounds harmless. The pain, not harmless at all. Inside the vaginal opening, there are 2 tiny glands about the size of peas. Their job is simple: produce lubrication. But if the duct gets blocked from irritation, infection, or even minor trauma, the fluid backs up, pressure builds, and boom, Bartholin cyst. Sometimes it's small and painless, other times it becomes infected and turns into an abscess. Hot, swollen, and unbelievably painful. Women describe the pain as like a burning knife between my legs, or like passing a kidney stone, but externally. In the ER, we often have to cut and drain it. Yes, it is exactly as unpleasant as it sounds for everyone involved. Causes range from bacteria like E. coli to STI to shaving irritation to physical activity, sex, ruptured ovarian cyst. Picture this: 1 minute you're living your life, the next a grenade goes off inside your lower abdomen. Ovarian cysts are common and usually harmless, but if one ruptures, fluid spills into the pelvic cavity, irritating nerves and tissues. Pain is sudden, sharp, one-sided, sometimes severe enough to cause nausea or fainting. Sometimes it's triggered by exercise or sex. Sometimes absolutely nothing, just your body choosing chaos. Treatment ranges from rest and pain meds to emergency surgery if bleeding is severe. For vulvodynia, this condition was historically brushed off for years with phrases like "it's stress" or "it's just in your head." But let's be clear, it's not imagined and it's not psychological discomfort. It is real, persistent physical pain that affects the vulva, the external intimate area. There is no visible injury, no infection, no swelling you can point to. Yet the pain can be intense, described by many women as burning, like heat under the skin stinging, similar to an insect bite that never fades. Throbbing, pressure, or a sharp electric sensation. And what triggers it can be something incredibly ordinary: sitting on a firm chair, wearing fitted clothing like leggings, riding a bicycle, or even the simple act of walking. What makes vulvodynia particularly difficult is that the pain can appear during moments that should feel neutral or pleasant, which can cause emotional stress, frustration, and even a sense of isolation. The cause isn't always crystal clear, but research suggests nerve pathways become oversensitive, sending pain signals even when no damage is present. Hormonal shifts after birth, after stopping birth control, or during menopause can make tissues more reactive. In some cases, pelvic floor muscles become overly tight, constantly bracing, which increases nerve sensitivity. And this condition is not rare. Studies estimate that up to 16% of women may experience vulvodynia at some point in their lives. But many never receive a diagnosis because they hesitate to speak up or because their discomfort has been minimized in the past. The good news: there are treatment paths and recovery is possible. Pelvic floor physical therapy to teach the muscles to release instead of clench. Topical numbing gels for flare control. Medications that calm nerve signaling taken orally or as a cream, and in some cases, carefully applied Botox injections to reduce muscle overactivity in the pelvic floor. The key takeaway: pain is never just something you have to live with. If someone is experiencing ongoing discomfort in this area, it deserves understanding, compassion, and proper medical support, not silence. 2. Endometriosis. This one is intense, not just physically, but emotionally and mentally as well. Endometriosis is a condition where tissue similar to the lining of the uterus begins growing outside the uterus on the ovaries, fallopian tubes, bladder, intestines, pelvic walls, and in some cases, even beyond the reproductive organs. And here's the difficult part. Even though this tissue is outside the uterus, it still behaves as if it's inside, responding to monthly hormonal cycles, which means every month the tissue builds up. Then it tries to shed, but there's nowhere for that blood and tissue to go. So instead of leaving the body, it becomes trapped. This leads to inflammation, swelling, scar tissue, and in more advanced cases, organs can actually begin to stick together. Yes, organs can literally fuse due to scar tissue, making even small movements internally extremely painful. The pain varies from person to person, but many describe it as a deep stabbing ache in the pelvis, pain that radiates into the lower back or legs, severe cramping that doesn't respond to over-the-counter pain relief, pain during bowel movements or urination, or discomfort and pressure that is always there in the background. And here's something especially important. The pain isn't limited to 1 week of the month. Some people feel it during ovulation, others during physical activity, others during intimacy, and some feel it daily, every single day, while still trying to go to school, work, raise families, and function like everything is fine. Yet, despite its severity, endometriosis is notoriously underdiagnosed. On average, it can take 7 to 10 years for someone to finally receive a correct diagnosis, often because symptoms are dismissed as just bad periods, stress, normal hormonal changes, or part of being a woman, which is both inaccurate and unfair. Treatment isn't one size fits all. Depending on symptoms and severity, options may include hormonal therapy to reduce flare cycles, pelvic floor therapy for associated muscle tension, pain management strategies, excision surgery where a surgeon carefully removes endometriosis tissue, and in more severe or advanced cases, hysterectomy, removal of the uterus. Though this is considered a last resort option, as it also means the end of natural fertility. The most important message: endometriosis pain is real. It is valid, and no one should have to push through it silently. Sex, childbirth, unmedicated. This is often considered the final boss of physical pain, not in a dramatic sense, but in a biological one. During unmedicated childbirth, the uterus, which is normally about the size of a small pear, begins contracting with a force measured at roughly 400 newtons. That's similar to the kind of force seen in high-impact sports injuries or sudden blunt trauma. But here, it isn't one sudden event. It happens repeatedly, rhythmically, and intensely, sometimes for many hours. Meanwhile, the cervix, which normally feels like a small, tightly closed opening no wider than a fingertip, gradually stretches to 10 centimeters to allow birth to occur. This is not a quick stretch. It's a slow, deliberate, overwhelming process. As labor progresses, pelvic bones subtly shift to make space. Surrounding organs adjust and compress. The abdominal and pelvic muscles engage like they're in a full-body athletic event. And the sensation arrives in waves, each wave building, holding, then releasing, only to rise again. For some, the pain feels deep and internal, almost like pressure radiating through the entire core. For others, it may be sharp, grabbing, or pulsing, especially if the baby is positioned in a way that presses on the lower spine, often called back labor. Modern medicine offers relief options, including epidurals and various pain management techniques. But not everyone uses them. Some choose not to. Some wish to, but cannot due to medical circumstances. And sometimes labor progresses so quickly that there simply isn't time. And yet millions of women around the world go through this process every year, not just enduring it, but emerging on the other side with strength and resilience. That is often underestimated or overlooked. Sex 0.5. When we talk about these conditions, cysts, ruptures, nerve pain, endometriosis, childbirth, it's easy to focus on the medical facts, the anatomy, the physiology, the treatment plans. And yes, those matter. But what matters just as much and often far more is the experience of the person living through it. Because pain, especially chronic or sudden, isn't just a physical sensation. It affects identity, confidence, intimacy, movement, relationships, and daily life. And for women, there's a long, unfortunate history of their pain being minimized, dismissed, or misunderstood. Phrases like, it's just bad cramps, maybe you're stressed. Women are supposed to deal with pain. It's normal. Don't exaggerate. These attitudes have caused countless women to suffer silently, to doubt themselves, or to push through conditions that absolutely deserved proper care and attention. So, here's the real takeaway. If you're someone who experiences any of the conditions we talked about today, your pain is real. It matters, and you deserve to be taken seriously. You deserve doctors who listen. You deserve answers, relief, and support. And if you're someone who has never gone through these things, this is your reminder to lead with empathy, to believe women when they describe their symptoms, to understand that many of these experiences are invisible on the outside, yet overwhelming on the inside. Bodies are strong, unbelievably strong, but that strength doesn't mean we should ignore suffering. Strength isn't enduring pain in silence. Strength is acknowledging it, speaking about it, and seeking care. So, whether you're dealing with one of these conditions now, supporting someone who is, or you're just here to learn, I hope today's video helped you understand a little more about just how complex, resilient, and powerful the female body really is. Thank you for watching, for learning, and for valuing this conversation. Stay informed, stay compassionate, and stay healthy.